Massachusetts got some grim news this month. Opioid deaths were up in 2022, with more than 2,300 confirmed and estimated opioid-related overdoses. That's up 2.5% from the year before and 9% higher than our pre-pandemic peak in 2016. Department of Public Health Commissioner Robbie Goldstein described these numbers as devastating and tragic, even as he and other public health officials highlighted ongoing efforts from the Healey administration to deal with the crisis. So, what's to be done? One idea that's been kicked around for years now is implementing supervised consumption sites, and after decades of operation abroad, they're starting to gain traction in the United States. New York City operates 2 of the centers, Rhode Island has legalized them, and here in Massachusetts, Somerville is moving toward being the first Bay State municipality to open one. On Beacon Hill, lawmakers are trying once again to legalize their operation, citing a new gubernatorial administration and a friendlier national presidential administration as signs that this may be the moment to try out every option. But there are risks. Illicit drug use for substances like heroin and unregulated synthetic opioids are illegal on the federal level, and plenty, including our former governor, don't buy the idea that the best way to deal with the drug crisis is to provide a place to consume those substances. So, let's get into it. I'm Jennifer Smith with CommonWealth magazine, and today I'm joined by Somerville Mayor Katjana Ballantyne and Sarah Evans with Open Society Foundations. Thank you both for being here.
Hi, it's so nice to be here.
So, Sarah, why don't you start us off from a broad place? When we talk about safe consumption sites, supervised consumption sites, safe injection sites, because they go by a few names, what exactly are we talking about and how common are they globally?
Thank you so much. I'm really pleased to be here today and to talk about this issue. So briefly, safe consumption sites or safe drug use sites or overdose prevention centers are places where people can go and use illicit substances under the supervision of trained staff and without fear of arrest, and knowing that the staff who are there will intervene in the case of an overdose or any sort of other medical emergency that might happen. These sites are actually nothing new. They've been around in the world for about 35 years. There are some 200 such sites operating in various countries around the world. Most of them are in North America or Europe, but not exclusively. There are sites now open in Colombia, in Mexico, in Ireland. There are sites coming up in Australia. So they really are around the world. Some of them have been there for 35 years. They've been studied extensively. And I myself operated a site in Vancouver, British Columbia when it first opened 20 years ago. So that's the length of my history with this topic, which is Insight, which was the first legally sanctioned public supervised consumption site in North America at the time.
So, Mayor Ballantyne, walk us through the history of the Somerville site here. Obviously, it predated your tenure, but is what Sarah described roughly what's being proposed there as well?
Thank you. So this really started from an idea from a counselor, Ward 1, Counselor Matt McLaughlin, put this idea forward. I want to say it was maybe 2017 or so. Then, as we know, the mayor in the city of Somerville makes things happen, and he put a proposal forward, my predecessor, Joe Curtatone, in 2019. In 2021, the city of Somerville partnered then with Brown University to conduct a needs assessment and feasibility study. And that's when the recommendation came to establish at least one overdose prevention center in Somerville that could also include harm reduction and supportive services for people who use drugs. And then in 2022, the city contracted with Fenway Health to develop a conceptual design, explore location options, and engage in the community process. And now we are exploring those options and the logistics ever since.
So one thing that I did kind of want to dig in with both of you on, so Sarah, you can feel free to start, is part of the question around these sites seems to be what the primary purpose is. We talk about them as kind of a potential two-hander, maybe something in between, of basically mitigating the harm that could happen from either the drug itself, if there's an overdose, unsafe usage of the drugs, if there are, say, unclean needles. And then you get into the question of, is this here to also reduce drug use? So how would you characterize the purpose of these safe consumption sites in general?
I think that the main purpose, to my mind, of these sites is to save people's lives, right? We all know people are dying of overdoses in our communities. It affects every walk of life, and overdose rates are growing at the fastest rates amongst some particularly vulnerable segments of our population and amongst BIPOC populations. So we want to be able to do everything that we can to make sure that nobody dies, right? And this is not an argument against anything at all, right? We need people, we want to facilitate people to get access into recovery and treatment services when they're ready, but they can't do that if they're dead, really. So what these sites, in my experience and in my mind, predominantly serve to do is to create a space where people who are at risk of dying of an overdose can receive the help that they need so that they don't die. And I say that really starkly because to me, that's always been the driving force around this. And I'm happy to say that in 35 years of these sites operating around the world, there have been lots of overdose events in these sites, and there have been no fatalities. So that's a huge impact. If we have this tool that works, that nobody needs to die, we should definitely engage with it. And I really want to congratulate the mayor and the city of Somerville for doing this, really. But having said that, I also want to say it doesn't stop there. In my own experience, operating one of these sites and basically being there day in and day out for some 8 years after Inside opened in Vancouver, you build a relationship with people. You create a safe space where people can be treated with dignity, where they know that you are there for their safety. And then out of that, a whole bunch of things can happen. People get the ability to make some other choices about their life. They get resources and connected to care so that if they want to go into treatment, they can. If they need housing, you can help them. If they need methadone, you can help them. If they have other kind of subcutaneous infections or chronic health conditions, you can help them. And none of those connections to care would happen without this kind of entry point that the site provides.
And then, Mayor, so how are you kind of squaring the circle here in Massachusetts? There have been a number of concerns raised over gubernatorial administrations. For instance, former Governor Charlie Baker said he didn't feel like this was kind of a strong enough argument to basically allow or encourage, again, depending on your viewpoint, allow or encourage illicit drug use, the fear of federal prosecution. Of course, former U.S. Attorney for Massachusetts, Andrew Lelling, said that there would be, federal charges probably brought against such sites if they were to open. So how are you thinking about the landscape legally as well as kind of clinically?
So legally and clinically. So thanks for that. I do want to echo what Sarah said. This is about saving lives. Okay. For the city of Somerville, that's 15 to 20 lives a year. Those are our neighbors. Those are, could be our parents, children, friends. And that is the whole goal. And this is a tool. There is data that shows it's evidence-based. And that, to me, is the driving force. I mean, last week we heard the statistics that in 2022, the numbers went up. Well, in Somerville, when I say, we have on average 15 to 20, in Somerville, it was 22. So we also increased. And so the goal is, saving lives. It's one thing I'd like to talk about is, the stigma factor. Our neighbors and our friends who are passing away, they are not bad people. They are friends, they are neighbors, they're loved ones who've been suffering from a disease, and they are isolated. And we have learned in Somerville that overdoses are more likely to occur when the individuals are alone. And for our community to save our neighbors and our friends and family members, an overdose prevention site offers the medical care, the peer-to-peer support for people who are not quite ready possibly to be sober, but patients can also use the site for wraparound services. So clinically, we are looking, I, along with my chief of staff, to police officers, to fire department personnel, EMS, emergency management, our E911, two staff from our Health and Human Services Department went down to New York City to On Point NYC to see how it's operating. And it was certainly eye-opening for everyone, these wraparound services. And that is a lot of what we've heard. When you come in, there's a welcoming center. There's somebody there to connect you with, are you hungry? Do you need medical care? There's a facility. So we are looking to have those wraparound services, because it has been, shared with us, the best practices are to not only, help with the disease, but then also meet people where they're at in order to maybe connect them to mental health services, or maybe they need to see a doctor for something, or they have, food insecurity issues. So we're thinking about it clinically. On the legal side, in Massachusetts, there are some serious legal risks in opening an overdose prevention center. And Somerville, as a municipality, is willing to take on those risks, but we're doing everything we can to reduce the risk for the operating site, for the client seeking treatment who might face potential criminal prosecution, for the service providers also at risk, their status of licensure.
How does the, national landscape end up factoring into this? The Biden administration could, in theory, have decided to enforce federal drug policy against, for instance, the New York clinics specifically, but hasn't. But there may well be in the future a president who doesn't feel that way and who might direct the Justice Department to treat these differently. Even maybe in Massachusetts, a motivated Democrat, because if you think about California, Gavin Newsom at the time did, I believe, veto legislation that would have allowed these sites. So how are you planning for possible changes in governance on the state and the federal level?
We are trying to be as current as possible on all that information, the legal information, making sure that we're in contact with how that landscape is playing out. But we're trying to be very thoughtful, very deliberate, making sure that we're current and in the moment on how that might shift. So it could propel us in a direction that is that helps save lives.
And Sarah, you're coming at this from a bit of a broader view here, of course. You're looking at this nationally, you're looking at this internationally. What is the sort of current landscape in American politics that you've been following that has impacted not just New York sites kind of opening up without state or federal approval, but then there have been, moves in Rhode Island, for instance, to move to allow these sites across the state. So how are you feeling about the patchwork of laws that we seem to be dealing with nationally?
Well, look, when you have city, state, and federal government, change is always a little bit of a patchwork, right? But the fact that there is a patchwork, I take as a really good sign, right? We are making progress. Somerville is doing the right thing. It's the obvious next step. It builds on efforts that have already happened. New York's sites opened, as we know, with city approval, so that level of governmental approval, which cities have the authority and the responsibility to do what they can about people that are dying because they are under the bridge or in the park or in the McDonald's bathroom or what have you, right? And so that's the jurisdiction under which the New York sites opened. And they continue to operate. We're now well into, what is this, the second year or third since COVID? I've lost track of time, but they've continued to operate under that jurisdiction this whole time. And I have every expectation that they will remain open. There was also an experience in California, the Tenderloin site, which opened, operated for a year, did so very successfully. And there's some really compelling data from that site. Now it's closed and they're reconfiguring and looking for a different venue, as I understand it, but it wasn't closed for any legal reasons. There are multiple jurisdictions around the country that are looking at doing the same with either city, county, or state level approval. In the case of Rhode Island, they passed a bill. So now these sites are legal. The Senate approved it. So the state has made it legal. Interjurisdictional, like what the state can do and what the versus what the federal government can do, is a complex issue. I'm not a constitutional scholar. I'm not even an American, so I defer to others to kind of talk about that. But my understanding is that cities and states have power to make these decisions, and certainly in the case of the Rhode Island, where it was voted on, through their legislative process, they have the power to make these decisions, and they're doing that. And they're doing it because there's 35 years of evidence that shows that these sites work. And the things that people are anticipating in terms of reduction in overdose death rates in the community around the sites, reduction in transmissible disease like HIV and hepatitis C at population level. We know from 35 years of experience that those outcomes come to pass, and that some of the other fears that people have, and I do understand there's fear around any kind of new intervention, and this one, because it has to do with, drugs, and drugs is such a deeply painful issue for a lot of people. I understand that there's fear around this, but none of the things that people are afraid of have come to pass in any of the sites. So there hasn't been a honeypot effect where drug users from all over the country, or when we opened ours in Canada, we were told by the then US drug czar that American drug users would flock to Canada to use this site. And honestly, none of those things happened. And now we kind of laugh and think that it was ludicrous, but we have the evidence to show that essentially the positives that we anticipate come to pass, the negatives that we fear do not come to pass. And that's why more and more jurisdictions are looking to do the right thing. And I just want to say, Somerville is leading the way here and is making a really important decision for the protection of the citizens of Somerville and the individuals who will use the site and the surrounding community. It's just logical, and more cities are going to be making this decision.
And so, Mayor, you brought up stigma, and Sarah, you've also talked about kind of concerns around flocking to these sites. Sarah, I wonder if you can tell me, looking back all those years ago to when Insight first opened, what kind of generalized safety concerns were you prepping for? What kind of potential worst case outcomes? And then how did you work to mitigate those? Because then, of course, I'd like to turn to the look ahead on Somerville.
Well, we did a lot of different forms of preparation, and because it was the first legal one in the country at the time, and in North America at the time, we were really like building it as we went. And so I won't go into all of the preparations that we made because some of them seem like ludicrous in hindsight. But I will say this, one thing that we did was a lot of education. Like, I view this as an educational activity. We did a lot of talking, like up and down in back alleys, you know, talking to people who might be potential consumers of these sites, and being like, what would it take for you to go, you know, to trust and to go inside and to use this site? Because we didn't want to open it and have it, we were worried that we would open it and nobody would come to it. It turns out that was not something we needed to worry about because people came to it in droves. But I think that's in part because of this process of community engagement that we did. And we also talked to all of the other stakeholders, including folks who were opposed to the site at first, or who were worried about what that might mean for the surrounding area, and just making sure that there was a process of really debunking some of the myths, and sharing the evidence and the experiences from other cities and other countries, in order to do what we could to bring people along in their understanding. And I'm happy to say that, and I've said this as well in other places, in the end, some of the biggest supporters were people who were initially not supportive, because they saw that the longer the site was there, the things that we said were good, like I'd said, did happen. The things that they were afraid of, the bad things that they were afraid of, did not happen. And over time, after the site had been open for a couple of years, local approval ratings were over 80%, which hadn't been the case before we opened. So over time, we saw more support, and we saw the opposition fall away as people realized what was actually happening at these sites was about saving lives and improving the quality of the neighborhood.
And Mayor, how are you feeling about Somerville kind of being the first mover on this? Other cities and towns like Cambridge are also looking at the possibility, but as is typical in Massachusetts, it looks like it's going to maybe be a municipality by municipality by municipality decision. So we've talked about the national patchwork. How are you feeling about the Massachusetts patchwork here? What kind of intercity demand, intercity communication do you expect is going to come about in the near future?
Yeah, so I'd like to talk about that, but I'd also like to talk about, you know, in a municipality, because we're so dependent on state and federal, is yes, we can look in-house, but because there are some bills at the state house right now, I spoke on behalf of those. I think it was last week, is that we have to make sure that the operators of these particular sites, and that the clients that are there are not hurt, or licensure for anybody who works there. So I'd say is we need to make sure there's a push that way. And then locally for the city of Somerville, you know, as I, you know, sort of as an outline of where we are, last year in the budget process, I had set aside $500,000 for operations and related costs. We have about 800,000 in that account. We've added nearly 200,000 more, so we're about you know, $1 million to go towards a modular unit. We have we're putting together the RFP for that modular unit. Feasibility study determined that a modular unit for the city of Somerville, we're in 4 square miles. We don't own a lot of land. Brick and mortar was not an option, that this would be the next step for us. We need to continue to work on logistics necessary to purchase that. And there's also supply chain issues that we're facing. This process, in terms of timeline, it does take time, but creating lasting results is what is most important for us. You know, I've been committed to opening a site that's not only serves the community, but also serves as a model for other municipalities nationwide. And we have to do public engagement. As Sarah mentioned, education is really important, making sure that we're being as transparent as possible and always getting better at that. I will say that I did, as an anecdote, have a father who said to me, you know, please, you know, we need to get these drug users outside of Davis Square. We can't have them here. My kids are seeing this, and so forth. And in the same breath, he was saying to me, we don't want an overdose prevention center. So then I just started asking open-ended questions. So how do you think we could do this? You know, and wonderful. First of all, he was willing, as a father of 2 young kids, he was willing to engage in the conversation. And as I started asking these questions, he's like, oh, like, okay, I get it. Well, if they're doing it right here, you know, maybe having a location for users to be able to consume safely would be a better thing. So it is important to continually engage, continually to give information, education, the latest information. Also, you know, just being honest is, are we making pivots or are we changing? Is just to make sure that there are no barriers there whatsoever. So that's about, you know, where we are at the moment, and have certainly said happy to work collaboratively and zooming out, you know, in terms of the state of Massachusetts. Happy to get input. Sarah, wonderful to see you and hear you in terms of, you know, the lessons you have all learned, the data that you have all shared, you know, the best practices that are out there. And again, this is about saving lives.
Thank you again to Mayor Katjana Ballantyne and Sarah Evans with Open Society Foundations for joining me on the podcast. And to our listeners, have a wonderful holiday weekend, and we'll be back in your ears next week.